So we finished treating her. Just to repeat, I had foam underneath each hemipelvis for 5 minutes. I kept the foam under there, and then I pushed on the sacrum for 5 minutes. And let's have you lie on your back, and we'll retest your mobility. So now there's a lot of lateral movement, and I can spring it, it recoils. Here's posterior rotation. So now we have mobility in that direction. We have mobility on this side. Lie on your stomach. So PSIS is right here. Sacrum is now deeper. Now my left thumb will override. If I slide straight across, it'll override my right thumb. So sacrum is now more anterior. I can spring the sacrum. I can see your heels move every time. So the force goes through the SI joint, into the hip joints, down to the lower extremity. Sacrum forward bends. L5 now has spring. Pelvis rotates forward. Pelvis glides inferiorly. Pelvis glides superiorly. Sacrotuberous ligament. I can now indent it. So that's normal. It should have a little bit of give. Lie on your back, please. So we didn't do anything to your neck, and now I can spring your mastoid. So now the upper cervical joint where the head and neck connect is freer. I can side bend it. I'm on the tip of the transverse process of the atlas, and I can glide it to the right now, and I can glide it to the left. And now I'm testing traction, and now your whole body moves. I see your feet move up and down. So this released reflexively by restoring motion in the sacroiliac joint.
Wow.
Okay? Just relax. Open your mouth slightly. Just let it relax. And I'm going to say this feels a little freer. I'll spend more time tomorrow evaluating that in detail. But that feels freer. Just relax. And now I can compress on each side. It has a little more compression. How's your jaw feel? No real difference?
No.
Okay.
Not real
When
difference.
you walked, how did your body feel after I treated you?
Oh, much freer. I felt like my arms were moving more and less stiff.
Very good. And were you aware of your neck being less stiff?
Yeah, I think it was.
Nice.
Yeah, I just felt like my whole body just
Wonderful.
felt a bit better.
Very good. And you know, if the sacrum truly is glided posteriorly, it's going to put a lot of tension on that pelvic floor, and that was reflected in the sacrotuberous being really tight. You know, part of that pelvic floor musculature attaches to the sacrotuberous ligament. And it's going to stretch the sacral nerves as well, especially the lower ones that supplies the pelvic floor, the bladder, etc., etc. So hopefully your pelvic floor pain, your pelvic pain is going to be a lot less now. Let me have you lie on your stomach again, and I'll demonstrate that we treated the coccyx successfully. Now the camera angle, I don't know if I was able to capture the fact that it was side bent or not. But the coccyx is now symmetrical. And that's in response by pushing on the ligaments on the right of the coccyx for 5 minutes and pushing directly on the left side, pushing it to the right for 5 minutes. And I can't emphasize how important it is to take 5 minutes to move these structures. We noted that when you walked, you had freer arm swing, and I noted more lateral pelvic mobility. So I think we're off to a good start. Let's do one more test. Let's have you lie on your back and let's test your hamstring length. So you were 60 degrees before that. I call that a little bit of a gain. Your thoughts? Feels a little freer?
Yeah.
Okay. Now
It felt tight when you had it all the way
Sure,
up.
sure,
but
sure.
It was, I think you got it up farther than
Yeah.
before.
Very good. Well, tomorrow I'll teach you self-treatment, and tomorrow I'll retest everything. And sometimes people come back and they then have a bilateral anterior ilium. You kind of hints that you might have a little bit of hypomobility in that direction. And sometimes it takes 24 hours for the next pattern to reveal itself. So tomorrow I'll look for what I describe as a bilateral anterior ilium. And it's part of what I call the second most common pattern of sacroiliac mobility dysfunction. And there's information on that on YouTube, and it's in my home study as well. It's in my book also that can be found on my website, HeschInstitute.com, H-E-S like Sam, C-H, institute.com. So thank you for letting me film this and share this.
Oh, thank you.